Hi, this is Pam from Your Nurse Advocate Consulting, and this is a Tuesday Tips that we're going to talk about something that is really close to home. I'm actually living in this situation right away. What do you do? How do you prepare to bring an aging loved one home, whether it's temporary or whether it's permanent? What do you have to consider? What do you have to think about? What are you afraid you don't know when you're getting ready to have someone move in? So if you're bringing an aging parent or loved one into your home, say after surgery or after a hospitalization, or because living alone isn't safe anymore, this is a big transition. And even ours is going to be temporary and it still is a big deal. So the smoother it goes depends on what you plan before, they get to your home. So today I'm going to be walking you through kind of a practical checklist in 6 categories. We're going to talk about home setup, medical care, medications, paperwork, personal care support, and equipment. So this is my real life situation. So I'm bringing my mom home. She's 2 weeks post, 2 weeks after hip surgery. My sister's home is being remodeled. They're adding a new bathroom. They're remodeling the kitchen to make a nicer space for my sister and brother-in-law, as well as my mom, for a permanent situation. The twist, I live 4 hours away from where she gets all of her medical care. So that means, we have to think through therapy orders, insurance networks, medication supply, what happens if there's an emergency and in a healthcare system that doesn't know her. So let's go ahead and dive in. So category one would be getting the home ready. And, think safe, simple, first floor living. Fortunately, one of the benefits that we had is my husband and I built this home. We were, in our 40s, and this was going to be our forever home. So we decided that we wanted to make sure that everything was handicap accessible and so that we could, live our life out, here as long as possible. So that's one advantage. All the doorways are wheelchair accessible. We have a ramp that gets into our home. We have, 2 steps of it or the ramp to get into the home. So if you go up the ramp, there's no steps to get in the home. So our bedroom is on the first floor. Our laundry, we have a mud room with the washer and dryer. Everything that we need is on the first floor. We have a loft where we can sleep 14, and that's where all the kids and everybody stays. But that's not going to work for my mom. My mom's not going to be able to go up those stairs, and our bed is pretty high up. So fortunately, we had a little taste of this when my husband's uncle had a horse accident, fractured his pelvis, was non-weight bearing, couldn't walk for 6 months, and he came to live with us. And fortunately, we have a main bathroom downstairs that with just some moving around of some furniture and things, we can fit a bed in there. There's a closet in there. There's a bathroom. We can make that work. So that's going to be my mom's temporary room while she's here with us. So again, think safe, simple, and first floor living. So start with these questions. Can they live on one level? Can they sleep there? Can they use the bathroom? Can they have meals? Can they shower? Can they do all those activities of living without stairs? Next thing is if there are stairs, is there a safe plan for how many times per day they'll need to use them? Maybe they can get up. So maybe, if everything's on the first floor and they have to go up just a couple of steps to sleep, that might be okay. But, we want to avoid, up and down, up and down, up and down all throughout the day. And if they can't do stairs, then we really have to focus on a first floor living arrangement. So again, like we talked with our, doorways being handicap accessible, are the doorways wide enough for a walker or a wheelchair? My mom uses a walker. And when we were on vacation, she stayed with us in our cabin. And that was horrible because the doorways she could not get her walker through the doorway. So if she had to get up in the middle of the night, she'd holler or call my cell phone. I was in the next bedroom over and say, you got to help me. I got to go to the bathroom. Well, we'd have to walk her to the doorway. She'd have to stand there. I'd have to, jiggle her walker around to get it out of the door and get her into the bathroom and then get her back to bed again. So this interrupted a lot of people's sleep for a week's vacation. But these are the things that you have to consider. Lighting. We have night lights all through the hallways. We have night lights in all the bathrooms. So if they do have to get up in the middle of the night, can they see? Are they going to be able to move around safely, especially in an environment they're not real comfortable in because this is new to them? All right, so let's look at a high impact home prep list. And let's start from the beginning. Look at the entry. Do you need handrails? Is there a non-slip surface? Is there good lighting? Do you need to consider that ramp if there are many steps or wheelchairs involved or a walker, and or if their sleep or balance is poor? So consider a ramp. There are, kind of pre-done metal ramps. And here's the thing about equipment. I want to tell you right away. Unless you're qualified to install grab bars, things like that. I mean, there are actually construction companies, small, large, medium, large, I mean, different sizes that have the credentials that allow them the special training they need to be able to put in grab bars and things so that they're not going to pull out of the wall and that they are, safe. So make sure that the person who's going to install these grab bars and things really knows what they're doing, and they have experience in installing safety equipment for seniors. So stable handrails, non-slip surface. Do you have a mat for your bathtub, for your shower? Good lighting, and we talked about the ramp. Let's look at the bedroom. The bed on the main floor if possible. Clear path to the bathroom. Remove throw rugs, cords, clutter. Make sure they have a clean, clutter-free path to the bathroom. And again, are they going to need a raised toilet seat? Do they have trouble, the toilet is too low, they have trouble getting, on and off? Do you need a handrail or, by the toilet? So what is the plan for them getting in and out of bed safely? And like I had mentioned, our bed is really high. There's no way my mom's going to get in our bed. And so bed height really matters. All right, let's move on to the bathroom. We talked about raised toilet seat, toilet safety frame, grab bars or a temporary grab bar solution. I'm not a big fan of those suction cup ones. They can come apart. I really don't like them. I'll just be honest with you. That's my opinion. That's my nursing opinion. A non-slip bath mat, shower chair or tub transfer bench. So how are they getting in? Do you have a shower? Do you have a walk-in shower? Ours is maybe like a 2-inch lip that she can step over, but our shower frame has a built-in seat in it. We have a handheld shower head so she can sit down and shower herself. And so we have that all set up and ready to go. And we do have we have a mat that goes on the bottom of the shower. And I would also recommend, if you've got a seat or that, maybe put a towel on there because that will help reduce the slipping on even a shower seat. And then a handheld shower head, which was what we talked about, so that they're not having to stand. They could sit where they feel safer, more secure, and be able to use that wand and be able to give themselves a shower. Let's look at the kitchen or the living area. So what are frequently used items that are at waist height that they need? Are they a coffee drinker? Are they a tea drinker? Are they able to make themselves breakfast? Maybe you're not home or you're working or you got other things. I mean, just have things out on the counters that they can access easily. We don't want them getting on footstools or, little ladders or things like that. So, or God forbid, standing on a chair. Stable chairs with arms, avoid low, soft couches. That's one of the challenges that a lot of elderly people have. They sink in and they sit back in a nice, soft, cushy chair or couch and they can't get out. And so you want to consider that. She has a lift chair at home, but she's been using physical therapy. She's been able to get in and out of her chair in working with physical therapy. So we're going to try it. We're not going to bring her chair with her when she comes here, but we do have our couch and love seat. All 4 ends are recliners, so she will be able to get her feet up and be able to recline. And then the last thing too is clear walking lanes for walker use. We have a lot of throw rugs that we may have to pick up for my mom. We don't have any real throw rugs that would be from the front room into the bathroom where she's going to be staying, but we do have a lot of throw rugs and I'm probably going to need to pick those up. So ask yourself, If they wake up at 2 o'clock in the morning and need to use the bathroom, can they do it safely? And can they do it without, having to wake you up because they just have, the space isn't quite right for them to be able to do it on their own. So let's move on to category 2, medical care and therapy coordination. So this is where long distance transitions can get a little tricky. Before discharge, so I'm going down to their home on Monday, and I'm taking her to her doctor appointment on Tuesday, and then we're coming home. So during that doctor appointment, I'm going to have to get scripts for physical therapy, find out if they're going to write orders. She's going to have another follow-up appointment. I'm not going to drive her 4 hours for a doctor appointment and 4 hours home. So we're going to see if we can get that into a virtual visit. Because it's logistically, it's just not going to be very practical to take her for a 4 hour car ride one way to go to a doctor appointment for a follow-up. And you can't expect an orthopedic surgeon in my area to follow up and manage a case that he didn't do, or he or she didn't do surgery on. So surgeons are kind of particular, they like to take care of their own surgery, but they're very leery to assume responsibility for someone else's surgery. So that's something that we need to get worked out. And so again, who's going to be the ordering provider? Will they order the therapy and work and sign orders for the home care company or the outpatient, therapy, because they can't provide therapy without a doctor's order? So will that come from her surgeon in Milwaukee? And then what if she needs medical care? I mean, we fortunately, her and I have the same Medicare Advantage plan, so I'm hoping logistically or with insurance that's going to work out, that she could still be in network if she goes to the same medical clinic or hospital that we would go to, that would be in the same insurance network. And outpatient therapy, we've got to make sure that we're going to a therapy company that is in network with their insurance. And, we talked about the follow-up appointments. We're not going to, I really don't think that they will transfer care up here unless, you never say never in healthcare, and every day is, things always change. So and without talking to the surgeon, maybe he's got a good buddy up here that works in a, perfect scenario. He has a good buddy that maybe he went to medical school with, or they golf together or whatever. And he's up here in the La Crosse area, and he would trust him to oversee my mom. That's always a possibility. Is that likely? No, I don't think so, but it is possible. So these are the things that we have to check out. And so the key question to ask the care team is, what's the expected therapy plan? And so I am going to, my mom's last physical therapy appointment is going to be on Friday, because she's going to come home with me on Tuesday. So I'm going to be available by phone and talk to the physical therapist when he's doing his discharge visit with my mom, and currently at my sister's home down in the Kenosha area. So I will be, I will find out firsthand from the therapist what he's looking at as far as what our continuing therapy needs would be. So this is going to help me when I go to the doctor appointment on Tuesday. Okay, this is what I need to ask for. So, again, the more prepared you can be before the move, the better. What are her weight bearing restrictions going to be? Right now, I know she's weight bearing as tolerated, so that's not as big of a deal for me right now, but it may be for you. Depending on their illness, their medical condition, their surgical status, do they have restrictions on any of their limbs, restrictions on activity, or any type of restrictions, food restrictions, fluid restrictions? Always, have to figure out what can they do, what can't they do, what can they eat, what can they drink, what can they not eat, what can they not drink, and the whole scenario. Do they need blood pressure monitoring? Do they need daily weights? Do they have, a heart condition where fluid retention could be serious? My mom has pulmonary hypertension. Fluid retention could be difficult for her. She's on oxygen, so we're going to have to bring her oxygen concentrator home. And so we have to make sure that we can accommodate that. And she has a portable oxygen concentrator that she can use for the trip. So that was a purchase that she made about a year ago, and she loves it because that allows her to be away from her concentrator and not have to use those big tanks. So her Inogen works really well for that. So what symptoms are normal recovery versus when should you call 911? Fortunately, I'm a nurse, I'm experienced, I'm very comfortable with caring for my mom medically, but if you're not and don't have that background, what do you need to know? What are some red flags that you need to be aware of that you need to reach out to the medical community in case something goes wrong? So let's look at insurance. Here's the reality check. Call the insurance company, find out which home health agencies are in network near your home, which outpatient PT clinics are in network. Do we need prior authorization? Remember, you cannot go ahead and do something and ask an insurance company for forgiveness afterwards because they will deny it and you'll have to do the bill. There's nothing, oh, I didn't know. Oh, this was a last minute thing. Oh, I didn't know. We didn't prepare. The insurance company is not going to say, oh, we're so sorry. Oh, of course we're not going to, bill for you that. We'll just put an authorization through. That's not going to happen. I mean, like I said, never say never. You might have a perfect health insurance plan that they're that accommodating, but don't bank on that is what I'm saying. So practical tip, ask for the discharge plan in writing and get the therapy orders sent before your loved one comes home. If this way you're not scrambling on day 3. So we're already getting all prepared for that. So the next category is medication management. So medication problems are one of the fastest ways that a transition can go sideways. And a transition, we mean transition in care from, say, to home to the hospital, the nursing home to home, or from my sister's home to my home. That's all transition, changes in levels of care. So what do you do before they get there? You want to make sure you have a complete updated medication list, including any over-the-counter medications and supplements, and confirm that. What's new? Are there new medicines after surgery? Were medications stopped? What medications might be temporary? Plan for a supply, at least when they arrive with at least a 30, preferably a 90-day supply of medications. And why I say this is that mostly, especially with the mail order pharmacies for an insurance company, they like to do 90 days. And again, you have to be in network. So it would be a complete hassle for a temporary stay, as my mom's going to be with us maybe a couple of months, to switch her mail order pharmacy to mail her medicines here 4 hours away, when chances are somewhere along the interim of her coming and going, they're going to get crossed and it's going to be a mess. So I've told my sisters she needs to have 3 months of medicines before she comes to my house, because this gives us plenty of time to make sure that we're not running out and we're getting it from an in-network pharmacy for her. And if we need to, we can ask, I could go online, make sure the doctor can transfer prescription up here to a pharmacy here if I have to, but that's not the optimal, but that is the plan B if for some reason she stays longer, or I mean that would be a secondary option. And use a simple setup system. My mom right now, she does her own medications. So right now I don't have to. I have to make sure that her supply is there and that we have all that dotting the I's and cross the T's, but she does self-administer her own medication. So she's pretty good about that. She has her schedule. She knows what she takes, and when she needs to take it. She takes Lasix that she doesn't like to take because it makes her go to the bathroom, makes her pee. So I'm going to have to make sure that she's staying on top of that, because that will affect her breathing with her pulmonary hypertension if she starts filling up with fluid. So yes, she does take them independently, but I am going to have to supervise those. What about constipation prevention, pain medicines, side effects to watch for any of her medications or any of her symptoms like her pulmonary hypertension, leg swelling, shortness of breath? Make sure you're aware of all of these things to watch for, if they have some kind of chronic illness. And so as a safety check, if they're forgetful, overwhelmed, or they have complex meds. I mean, some of our clients have 20, 30 meds, medications. And, so just assume that they're going to need some supervision, at least during the first couple of weeks, to make sure that you have a system, in place and that works. So category 4, documentation. What if something happens here? Now, I asked my sister, they knew my mom had an advance directive, like if something were to happen, what her wishes would be. And they had to find it. So my sister did locate it. She sent me a copy. So we're all good with there. My one sister is a nurse practitioner. She's in that number 1 spot. I'm in that number 2 spot for my mom. So I am on her advance directive, which means the hospitals and the clinics and the home care and all that will be able to talk to me, and I can talk to them on behalf of my mom. If you don't have those things in place, it's going to be difficult for you to um, be able to communicate on your loved one's behalf, especially if they already have dementia or are confused and you're not on that advance directive to be able to, or he or she's not able to give you permission to talk on their behalf. So that's another thing you want to make sure. Insurance cards, photo ID, med list with allergies, diagnosis, problem list. I have that. I've downloaded and copied and printed that off from my mom's My Chart. So I've got all that ready to go. The name of her primary doctor, the name of her surgeon, all those good things you want to make sure that you have, or any other specialists, whether it's pulmonology, urology, whatever, any specialty doctors that may be involved in the care of your aging loved one. And so we talked about the advanced directives, healthcare power of attorney, who's the proxy, living will if they have one, a DNR, all that should be, those documents should travel with them. Make sure you know who's the decision maker and what are their wishes if something changes suddenly. If for some reason my mom goes to the hospital and she's not able to make her healthcare decisions, who do I need to call? Yes, I'm second in on the list, but yes, I am obligated to call my sister, who is first on the list, and the nurse practitioner, and her and I together will figure things out. Category 5 is personal care and daily assistance. What are they going to need? Are you working? Are you working outside of the home? Are you working in the home? Do you need to make sure that you have certain hours covered in the day? Is there a adult daycare in your area? That's normally private pay, but can they go there during the day while you're at work? And so you've got adult daycare. Can you have a personal care worker or a companion aide or someone from a non-medical home care company come and sit with them or prepare a meal, spend a couple hours with them while you're gone because you don't like them to be 8 hours alone. So these are the things think through the day. Who helps with bathing, dressing, toileting, transfers? Can they safely be left alone? If they can, how long? Maybe you just need to have someone come for a couple hours at lunch. You get them breakfast, someone comes at lunch for a couple hours, make sure everything's good. And by the time you get home 4 or 5 o'clock, everything's okay. And if not, you may need more help. So home health medical versus home care, non-medical, are very different. So Medicare pays for Medicare skilled care. So for example, if my mom would still need in-home physical therapy, that would still be covered under Medicare, and that would be covered. But if she needs custodial care, like someone just to bathe her or someone to prep a meal or maybe do her laundry or sit with her or drive her here, do something, that's non-medical care. Medicare does not cover that, and that would be privately paid unless you're on Medicaid and you have a care worker with your Aging and Disability Resource Center that they would have to make arrangements to provide that care for you. And my mom does not need that level of care right now, but if your aging loved one would, that's a big thing because, she resides in one county and those funds might not be available in the county you're going to. So again, this is something, if you're planning that and they're on Medicaid and they have like a Medicaid HMO in their county, that's going to require some planning before they move up as well. All right, so the last category is category 6, home medical equipment. Equipment should match the mobility plan. So for example, like my mom, common post hip surgery needs. A walker, she was using a walker before surgery. A shower chair, raised toilet seat, grab bars, reacher, grabber, a sock aid if she needs trouble pulling up her socks, a bed rail. And when I say a bed rail, oftentimes a bed rail is not to keep them in or keep them from falling out or keep them trapped in the bed, so to speak. It's to give them something to hold on, to turn over, turn from side to side, and then to help them get up in the morning. So it's more of an assistive aid, that rail is, than than it might, use like for maybe a toddler where you've got rails because they're just learning how to sleep in a bed and they're going to fall, they could fall out of the bed. So the bed question is the bed height safe for standing up without strain? Is the mattress supportive enough? Do you need a temporary bedroom setup on the main floor? And that's what we're doing. We have to do a temporary bathroom setup. So let's go ahead and wrap this up. We've touched base on a lot of things. If you have a unique situation or something that we did not cover, that's what we're here for. Give us a jingle. We do a 30, send us a message. We do a 30-minute free consultation, answer a couple questions. If you need more help or more extensive services in planning, we can certainly help you do that. That's what we do. We do that every day. So in wrapping up, when bringing a loved one home isn't just making space for someone, it's a coordinated plan that includes home safety, possibly therapy, possibly doctor visits, medications, paperwork, and a lot of support. So if you're preparing, for a move like this and want a second set of clinical eyes in the plan, like I said, we're always available to help you build a transition checklist that would be specific to your aging loved one and coordinate any needs that they might have, any specialties such as therapy or someone to come in the home and assist, and make sure nothing critical gets missed. I mean, just kind of read between those lines and make sure that we're letting you know some of the things that you may not know. And so if this topic really hits home for you, save this video, share it with a sibling or a friend, or with someone that is about to bring a parent home, whether it's after surgery or another hospitalization, or just like in our case, where my sister's going to be remodeling her home. So with that being said, thanks for joining us for Tuesday Tips, and we'll see you back here soon. Take care now. Bye-bye.